Medic 2, Medic 2. Medic 2, you are requested to assist Med 1 with an imminent childbirth. Timeout 13:23.
Okay. So we're going to leave the station in the ambulance. We're going to go emerge into the scene. I got the monitor, you'll grab the bags. I'll be on the chest with compressions if need be. And Graham, if you want to take over airway, make sure you're buckled in before we go. And do you have any other suggestions?
Nope, I think that's good. Why don't we head out there?
All right, sounds good. Great. Med 2, Med 1, are you in there? Where are you at?
Come in.
All right. All right. Graham, it looks like they have delivered here.
Yep.
So, Med 1, what kind of report you got for us?
So, Medic 2, we just delivered the child. Mother was initially found unresponsive, barely breathing. We administered Narcan. She stated that she was in her 3rd trimester, but she hasn't had any prenatal care, hasn't been to the doctor at all. Initial APGAR was 1.
Okay.
We're going to take care of the mother. You guys are going to take care of the newborn here.
Okay.
I'll take over ventilations from you guys.
Alright, so I'm just drying the kid off. Gonna go ahead and I'm feeling for a brachial pulse. Patient does have some signs of cyanosis over the entire body. Did you guys suction out the airway at all?
Yes.
Okay. Alright. Any issues with compliance there with
Nope.
ventilations? Okay.
Compliance is good.
So we're gonna have that BVM and high flow oxygen. I have a pulse less than 60, so I'm gonna go ahead and do compressions.
Alright, I'm gonna hook up the high flow oxygen.
8, 9, 10, 12, 14, 16, 17, 18, 20, 21, 22, 24, 25, 26, 27, 28, 29, 30. Go ahead and give a breath.
Okay. Very good.
We're going to switch to 15 to 2 then.
Okay.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Alright, give me breaths to see if there's any
6, 7, 8, 9, 10, 11, 12, 13, 14, 15. I'm going to go ahead and get on our radiogram.
Okay.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And I'm going to have an engine crew respond if possible, available. Dispatch to Med 2.
Go ahead, Med 2.
You have an engine crew respond to this, seeing we are currently resuscitating a neonate. 15.
Copy that. We will dispatch engine crew.
10 4.
Tell me if you need to switch out for CPR.
12, 13, 14, 15. So in between ventilations here, why don't you go ahead and get stuff out for an IO?
Sure.
9, 10, 11, 12, 13, 14, 15. I'm going to go back to 30 and 2 here. 9, 10,
Insert an OPA.
13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 24, 25, 26, 27, 28, 29, 30. Alright, we're going to go ahead and do a rhythm check, pulse check.
OPA is in.
Do you have a pulse at all, Graham?
Yeah, we still have a pulse. It is still slow.
Alright. Okay, we're going to continue compressions. 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21,
Gonna get ready to intubate.
24, 25, 26, 27, 28, 29, 30.
Responding engine to Med 2.
Go ahead, engine 1. This is Med 2. 1, 2.
Medic 2, we are currently stopped by a train. We'll advise when we're back en route.
Med 2 copies. We'll see you when you get here. It's going to be on the 2nd floor.
Gonna intubate.
Go ahead and intubate. 2nd floor, lot 12. You'll see our ambulance. Okay, intubate.
Copy that, Med 2. We will advise you.
Alright. We are at 12 at the teeth.
Go ahead and give a breath.
Giving a breath.
Go ahead and give a breath.
Breath.
And a breath. Okay, good. Negative epigastric sounds and bilateral positive lung sounds. We're going to hook up end tidal capnography to this and ventilate one breath every 3 to 5 seconds. 1 to 3 seconds, and we're going to also have continuous ventilations here. Okay. So Med 1 advised that we have an APGAR of 1. I don't see any changes with him. I'm going to go ahead and get manual IO going here.
Okay. Tell me if you need to switch out for CPR.
I can kind of multitask. If you can slide me the blue bag.
Sure.
Looks like we have an end title of 84 with a pulse ox of 75. Good. Thank you. Okay. Alright, we're going to use a manual IO for this kid. I'm going to find my site, clean it off, measure it so we don't go through the leg. I go ahead and twist down and in, stabilize, hook up my extension that's pre-flushed. I go ahead and pull back. I do see bone marrow. I'm going to go ahead and flush. So this patient is about 2-3 kilograms.
I would say so. I would say 3 kilograms.
3 kilograms, so we're going to do 20 mLs per kilogram. So let's go ahead and get 100 cc bag of fluid out here.
Sure.
Alright, we're going to do a med check. So we have 0.9% sodium chloride injection, 100 cc bag. Expiration looks good. We're going to flush our line. We're going to be using microchip tubing.
Okay.
Okay, our line's flush, looking for no issues with any bubbles. Let's go ahead and do a rhythm check. We're going to stop, check for a pulse. I'm going to hook this up.
Pulse
Any
is present,
changes
but
there?
still slow.
Still slow, okay. Continue compressions here. Alright, so for a child this small, we're going to go ahead with 0.1 milligrams of epinephrine. Do you concur?
Yep.
Okay. So of this, we're going to do 0.1 milligram per ml, so this is going to be 1 ml. So I'm going to attach this to my, if you want to go ahead and do compressions for me.
And we have the intubation tube stabilized.
Oops. Okay. End tidal looks like it's going down, which is a good sign. We're down to about 70, and pulse ox is increasing to 85. Alright, so I have this flushed. 0.1 milligrams per ml, so we're going to give 1 ml. Do you concur?
Concur.
Okay, through the IO here. Gonna clean my site. Gonna twist on, and I'm gonna give 1 ml. Okay. 1 ml of epinephrine is in. I'm gonna go ahead and document. Alright, 11:52 we gave 0.1 milligrams of epinephrine. You're still doing okay, I can take over compressions.
Okay.
Alright, you got that secured. Still good compliancy, no issues.
Yep, good compliance. How is the skin looking now?
Skin is improving a little bit. We still have cyanosis in the toes there.
Alright.
Any other thing, Graham, that you can think of? We have airway managed, ventilations are good. We're doing compressions. We have an IO with 60 mLs of normal saline running. We'll have that on a pressure infusion bag. Otherwise, we can just use saline flushes. We have 0.1 milligrams of epinephrine given about 3 minutes ago. So I'm going to have you go ahead and do compressions.
Okay.
Now I'm going to get another milligram of epi ready. I'll actually keep this one because, give another ml. So we're going to give another epinephrine, 0.1 milligrams per 1 ml. So again, we're down to 1. We're going to go down to 2. Do you concur?
Yep.
Okay, we're going to go ahead and push the ml.
Okay.
This little guy warm. Okay, we got compressions.
Okay.
Alright. So epi at 11:56 was given.
Some other things to consider. Patient was just born out of a female who overdosed. Some heroin could be in the baby system.
Okay. go ahead and look at our medications here for some Narcan for peds. Still no issues with the airway, Graham?
No issues.
So this patient weighs 3 kilograms.
Yep.
We're going to give 0.1 milligrams per kilogram of naloxone. I'm going to go ahead and have you do compressions.
Sure. And this Narcan might be able to get some of the respiratory drive back to the baby.
Mm-hmm. Alright, so go ahead and get. So we have naloxone 4 milligrams in 10 ml, so 0.4 milligrams in an ml.
Yep.
The patient weighs approximately 3 kilograms. Narcan administration is 0.1 milligram per kilogram, amounting to 0.3 milligrams of Narcan. I'm going to go ahead and draw up 0.9 mLs.
Okay.
I have a small TB syringe here that I can give. Clean the top of this. Go ahead and insert my air and draw out 0.9.
0.9.
Okay. I'm going to go ahead and give the Narcan. Clean my site. Twist this on. And we're going to push. Narcan given at 12:03. Consider another round of epi. Last epi was at 11:56. It has now been 5 minutes. We're going to go ahead then and give another ml, 0.1 milligrams of epinephrine. So this will be round 3 of epi. Okay, third ml is in.
All right. Take over.
Looks like your end tidal is down to about 40, and your pulse ox is up to about 90. And I got a rhythm change here. I'm going to go ahead and assess. I do have a mechanical pulse with that. Our rhythm is showing a heart rate of 100. So we're going to stop compressions.
Okay.
We're going to go ahead and get this patient wrapped up.
Sure.
Still good with the airway?
Yeah, he actually feels like he might be bucking the tube a little bit now.
Okay. All right, we're going to consider some meds when we get in the ambulance.
Sure.
Go ahead and get everything set here.
Color is improving.
Okay.
Trunk appears a lot more pink.
We'll get our bags together here, Graham. I'm going to run out quick and bring these to the ambulance,
Okay.
and I'll be back.
Hold on. Okay,
Good?
keep going. Yep.
I do have the heat warmed up in here, Graham.
In the
Get
ambulance.
the oxygen switched over. Yep, heat's
Okay.
on. Alright, if you want to go ahead and scoop them up.
Sure.
I'm going to grab that IV bag just a second. Oops. Alright.
And we will move to the ambulance.
Yep. You got the warm blanket sitting there. I'm going to give you, here's this, again, the oxygen. I have
Yep.
that switched over. Any changes, Graham, at all? Still, is the coloring still doing okay?
Yep. Peripheral extremities are starting to become more pink as well.
Good.
Baby is becoming more active.
We notified the hospital that we have a neonate coming in, so the ER is ready and prepared for that.
Sure.
Med
2 to Riverview Hospital.
Med 2, this is Riverview. Go ahead.
Med 2 is coming in with a neonate baby. We will give further report upon more assessment, and we will be heading into your facility soon.
Copy that, Med 2. Medic 1 also advised. Thanks for the heads up.
Okay, so continue to give respirations while we do another APGAR check for this middle guy.
Okay.
So his extremities seem more pink in color. Trunk is also pink. We have a heart rate of over 100.
Mm-hmm.
Activity seems to be improving, seems to be flexing, and muscle tone seems to be improving.
Okay.
So I would rate this baby closer to a 7 at this time.
Okay. So we improved with the APGAR from an APGAR of 1 to an APGAR of 7.
Yep.
All right.
So we'll keep him covered now.
Okay.
Keep him warm.
Can you go ahead and grab me the blood pressure? See if we can get a pressure on this dude.
Okay. There we go. We'll run that.
All right. So we have him intubated. We're ventilating him with high flow oxygen.
Mm-hmm.
Pulse ox is increasing and end tidal is looking better.
Yep.
Do we get a blood pressure on him? Take a look here. All right, about 40/20, so it's better than, or it's decent for this kid's age. It's on the lower end, but we're gonna go ahead and we have that fluid bolus going, so that's gonna help with that. We have perfusion is increasing, so that's looking good. So we're about 10 minutes away from the hospital, Graham, if you want to hop in.
Sounds good.
Go ahead and drive.
Alright. We will be going en route to Riverview.
Yep, so patient is unstable. We have perfusion is increasing with BVM ventilations on the end tidal, or excuse me, the ET tube. But we're gonna go ahead and we're about 10-ish minutes away. So let's go emergent. You already notified the hospital that we're coming, so.
Yep. So we will be going emergent to
Thank you.
Riverview facility.
Okay. Continue ventilating. So we're gonna reassess the vitals every 5 minutes. I'm gonna go ahead and we have our end tidal on still. Tube is still set. No changes there. Checking for another pulse here. Pulse rate on my monitor says about 120, so that's improving. Gonna keep the patient warm. Hey Graham, is the heat all the way up for us?
Yep, it's all the way up.
Okay, good. I'm gonna go ahead and see if this patient's got any reactivity in its eyes. So open up. Somewhat reactive to light, but doesn't open spontaneously. So. Seems like the Narcan administration that we gave helped with perfusion. We're going to let the hospital know on my report that we do have a child that came from the heroin addict mother. She's being treated there right now. I'll go ahead and give her a radio report. Med 2 to Riverview Hospital, Med 2 to Riverview Hospital, do you copy?
Med 2, this is Riverview. Go ahead.
This is Med 2. We are currently transporting a neonate to your facility. We have an ETA of about 3 minutes. Per Med 1 on scene, we had our initial APGAR of 1. Patient did undergo resuscitation efforts. Patient was given 3 rounds of epinephrine via IO. He does have an IO in the right leg. He had 0.3 milligrams of epinephrine. He also was given 0.3 milligrams of Narcan. Patient is currently intubated. Ventilation is being performed with a BVM on high flow oxygen, 1 breath every 3 to 5 seconds. ABGOR was just reassessed and is up to an 8 now. Patient is stable. Patient is being warmed. If you want to go ahead and get your neonatology team ready for this patient when we get there. Like I said, ETA is about 3 minutes. Do you have any comments, questions, or concerns?
Copy that, Medic 2. We will have neonatology crew ready. We'll see you when you get here. KWX 685 clear.
Med 2 copies, clear. Go ahead and see if our APGAR has changed. Stimulate the guy a little bit, see if there's any stimulation. Oh, his curls kind of, or I'm sorry, his toes kind of curl when I do this, so we're looking good. So, Graham, are we just pulling in the garage? I hear the garage door opening.
Yep, we're just pulling in.
Alright, I've got this little guy warm. He's improving, so let's go ahead and get out and get him into the ambulance, or into the ER.
Alright, I'll come around.
Alright. Just gonna wrap him right up with this, put a
Sure.
pad underneath him.
I'll grab the monitor and everything if you want to scoop them up.
Mm-hmm. Good.
And we'll bring them in on oxygen as well.
Yep. Get our portable.
Go.
Alright. You'll have to grab the door for me.
Sure.
My hands full.
Go on
Hey,
in.
Riverview Hospital. Got our neonate here.